Hi, everyone, and welcome back to the second breakout session of Thrive 2020. My name is Loretta Maddox, and I am a senior compliance consultant with Healthcare Compliance Professionals. And I am happy to continue the conversation that we started in the last breakout session on managing remote workers. So, we're going to, like I said, continue this conversation, but this time we're going to focus on the security aspects of managing remote workers. So, just as in the last session, this is a recorded session, but I am available right now for live chat. So as I go through the information, if there is anything you have a question about or anything that as I'm talking about the material you want to ask a question, please put that in the chat and I will be happy to answer that. And then I'm also going to be available at the end. So with that being said, I'm going to go ahead and share my screen and let's get started with the material. So we are going to be talking about, like I said, security of protected health information when you are utilizing remote workers. And so in this session, what I really want to do is I want to focus on the HIPAA aspects. And since we have had enforcement discretion for telehealth, I think there's been a little bit of a confusion about what that covers. And so I want to go over what the enforcement discretion covers, what it doesn't cover, and then how you can apply that within your practice. In addition to that, I also want to explain some of the things that you need to look at from a technology standpoint. Now, in the last section, we talked about just managing employees. This is really going to be focused on the security aspect and how we can control the risks that can impact your practice when you do utilize remote workers. And then finally, I'm going to hopefully give you some practical steps that you can utilize within your practice to help you reduce any of those risks that we have identified. So we are first going to start with what is enforcement discretion? What does it mean? Well, obviously it was and is applicable to applying telehealth during the COVID-19 crisis. And it doesn't matter what you're treating the patient for. It doesn't have to be specifically related to COVID-19. It can be any service that you're providing. But if you're providing it through telehealth, then this enforcement discretion applies. It also allows you to use alternate communications, which we're going to talk about a little bit more. I think we were probably using some of those alternate communications prior to enforcement discretion, maybe not necessarily following all of the HIPAA rules. So I do want to expand on what is covered right now, but the things that we need to watch for in the future as far as making sure that once this enforcement discretion is gone, that we are still complying with HIPAA. And then it also waives any penalties. And I really want to talk about this aspect because this is where if you have a situation that occurs where there is a potential breach of information during a telehealth visit or by offering telehealth, the Office for Civil Rights is not going to issue penalties for that, but that doesn't mean that they won't investigate the situation. So for now, enforcement discretion means that you're not going to have a penalty for that, but going forward, there could be penalties. And so that's what I want to help you with. So what this is not, enforcement discretion is not the opportunity to just forget about HIPAA. So, and I think many of you, probably all of you on this conference right now understand that, but I just want to enforce it because this is very specific to providing telehealth. So I think most of you understand the purpose of enforcement discretion, and it's really given us an opportunity to treat patients where they are and to protect not only the patients that are at high risk, but it also protects your employees, it protects your providers, and it allows you the opportunity to provide greater access. So I think from the enforcement discretion standpoint, this is opening up an opportunity, not just from a HIPAA standpoint, but also from a payment standpoint, which I know you guys have listened to a breakout session already about payment related to telehealth. But I think this is an opportunity that we are not going to backtrack from. So I think this is here to stay. I think telehealth is something that is being incorporated even more now than it was before and will continue. So the types of communication that you can use that were included in enforcement discretion. So the OCR wants you to use private remote communication technologies. So we are going to be using Apple, whether it's FaceTime, Facebook Messenger, Google Hangouts, or even Skype to communicate, but we want to make sure that it's a private communication. We do not want to be utilizing any type of public facing remote communication. I can't imagine anyone listening to this presentation thinking that it's okay to provide healthcare through TikTok, but the Office for Civil Rights felt it necessary to say that. So I just want to remind everyone, we're not going to be using Twitch or Facebook Live to provide telehealth communications, because that would not be covered under enforcement discretion. So the different methods for providing telehealth, and this is where I really want to focus. So providing telehealth can be provided over the phone. It doesn't necessarily have to be video. It can be a phone call. And I will tell you that I've experienced this in my own personal situation with my mother, who is 82 years old. She lives in Arkansas and I am in California. And because of travel restrictions, I couldn't get back to her to take her to her cardiology appointment and her internal medicine appointment. And since I'm her primary caregiver, that made it difficult. But we were able to get on a phone call with both of her physicians. There is no way that she would have been able to get on FaceTime, for example. So the fact that we have the ability now during this public health emergency to provide care in alternate ways, I think is a huge plus for our patients. But we still have to consider the risks associated with that going forward. Now, a phone call, that was perfectly fine. It worked. It was a three-way phone call with my mom and me and her physicians, and that all worked great. But in your practice, I also want you to think about the other ways that you're providing telehealth. You might be providing them face-to-face. You might be using a telehealth platform. You might be using FaceTime. You might be using Skype. But whatever you're using during enforcement discretion, as long as it is private, that is covered by enforcement discretion. And in addition to just audio and video, we also have the ability to text message our patients. And this is that area where I think we're going to have problems going forward, because we had problems prior to enforcement discretion. There was a lot of text messaging happening between healthcare providers and their staff, healthcare providers and patients, and a text message in general is very difficult to secure from a security rule standpoint. So while we are doing this from a telehealth perspective under enforcement discretion, and we don't have to be concerned about penalties, what we do have to be concerned about is making bad habits now that are going to continue after enforcement discretion is gone. So I really want you to look at the practices that you are doing in your organization and determine, are these things that can be sustained after enforcement discretion, or do we need to make some changes so that we can be compliant? And that's really what I want to help you understand. Granted, the way things happened with COVID, it was so quick that we had to make changes. And so I am thankful that we have this enforcement discretion. But what I don't want to have happen is for us to get so comfortable with it. I mean, we are now 6 months in now since things have really, really changed. And have we really made the necessary changes to move forward in a HIPAA compliant fashion? So that's what I want to help you with today. So your responsibilities as a healthcare provider during enforcement discretion, you still need to be informing patients of potential privacy risks. If you are using a platform that is not HIPAA compliant, yet still falls under enforcement discretion, you're fine from a HIPAA standpoint, but you need to let your patients know that there may be privacy risks so that they can make a choice. Do they want to continue, or would they rather look for an alternative? You also, it's just a best practice to document that verbal consent. If you have given them the opportunity, if you have told them about the risks, and now you are saying, okay, are you agreeing to these risks? Document that in the record so that you can have that to show that you did take that extra step. And then if you are using a platform that has enhanced security, I recommend, and so does the OCR, that you go ahead and enable those security measures. If there is encryption available, if there are privacy modes available, whatever you can do on your end, you want to make sure that you're doing that, even though we are under this enforcement discretion umbrella. Now, after enforcement discretion goes away, and really right now is the time, because at some point this is going to go away. And I think now is the time to go ahead and focus on it, because like I said, I don't think providing telehealth is going to go away. I think this is going to be something that continues on, because we found that it can be very useful to your healthcare providers and to your patients. So right now is the time to be looking at, first of all, using telehealth and providing telehealth. We've got to include that as a part of the security risk analysis process. Just as a brief reminder, the security risk analysis is required by the security rule. It is also required if you are participating in MIPS or any other alternative payment model. You're required to attest that you are doing a security risk analysis. And so as a part of that analysis, you have to look at all of the potential threats and vulnerabilities to any electronic protected health information that you hold or that you access, transmit, receive, or create or store. So when you are providing telehealth, that is a real-time transmission of protected health information. So you have to include that process in your security risk analysis. Now, right now, we're under enforcement discretion, so that's not an issue. Going forward, that will have to be a part of your security risk analysis. Then, if you can, use a HIPAA compliant vendor. There are many out there, and I'm going to share what was included in the OCR's guidance in just a couple of minutes, but why wouldn't you? If you can use a HIPAA compliant vendor, go ahead and do that. Because in addition to using a vendor that says that they are following HIPAA rules, what that's also going to do is give you the ability to execute that business associate agreement. Now, most of the vendors that are large are probably going to want you to sign their business associate agreement, or they're going to include that in their contract. That is fine as long as you have a business associate agreement in place. I would recommend that you review it. And if there is anything in there that you do not agree with, I would recommend that you have legal counsel also review it so that you can make sure you are protected. But the bottom line is, if you are using a vendor to provide telehealth services and you do not have a business associate agreement in place, after enforcement discretion goes away, you would be in violation of the rule. So we want to make sure that we're taking those steps now to get you there, to get you compliant. So I do want to reiterate that right now, covered entities are not going to be subject to penalties of violations of the privacy rule, the security rule, or the breach notification rule if you are providing telehealth services in good faith. And we're going to talk about what bad faith is in just a second. But this is during the COVID-19 public health emergency. Enforcement discretion does not apply to other rules that are associated with HIPAA unless it has to do with telehealth. And that's why we're going to talk about remote workers in just a second, because even though COVID-19 has caused us to move to a remote working environment, that does not mean enforcement discretion covers it. Enforcement discretion covers providing telehealth services, and that is an important aspect to remember. And then finally, there is no expiration date that has been issued as of now. So the OCR will inform the public when enforcement discretion is no longer applicable. And I foresee that being when the public health emergency is over, but we're going to have to wait to get that information from the Office for Civil Rights. So in my opinion, while we are in this window of time where we're under enforcement discretion, this is the time to get our ducks in a row and to make sure that once we move forward, because things are not going to change the day that they say enforcement discretion is over. Whatever you are doing in your practice, and you guys all know this, whatever you're doing right now, you're probably going to continue to do if it's working. So let's figure it out right now so that we can be compliant prior to the OCR saying enforcement discretion is gone. So I said enforcement discretion applies to good faith provision of telehealth services. Bad faith is basically if you are committing a criminal act, if you're trying to sell patient data, if you are violating any of your state or local law or any type of professional ethical standards, that's bad faith. So if you're doing that in a telehealth format, you're not going to be covered under enforcement discretion. Also, if you are using any public facing remote communication, like I talked about earlier, like TikTok or Facebook Live or Twitch, that's not going to be covered because they have specifically stated this is not okay. So they're giving us some wiggle room on some of these other ways to provide telehealth that maybe aren't HIPAA compliant, but they did draw the line. So we want to make sure that we're not crossing that line. So we did get some encouragement from the OCR. And I think anytime we get encouragement from the government, granted, it's not a requirement, but if they are encouraging you to do something, I think it's in your best interest to do that. And because they have given us this window of enforcement discretion, we want to take advantage of that, but we also want to be smart in your practice. So the OCR encourages you right now to use video communication vendors that are already familiar with the security rule requirements and that will provide or execute a business associate agreement. So like I said earlier, even though we are in this window of time that you can get by with not doing those things, the OCR is saying the same thing right now. Let's go ahead and get compliant. So because they gave us that encouragement, they also provided a list of vendors in their notice. Now, this is not an endorsement of anyone, but this was information included in the OCR's notice. And these are vendors that hold themselves out to be HIPAA compliant and that have said they will sign a business associate agreement. So this is a good place to start. Many of you are probably already using one of these vendors, but if you are in a situation where you're not, maybe you are still using FaceTime or something along those lines, then if that's working for your practice and your patients right now, that's okay, but let's go ahead and look at another alternative. So this is just a good place for you to start. So we're going to transition now to remote workers. And granted, remote workers could also be providing telehealth services because you may have providers that are providing telehealth from home. So they may fall into both camps. But what I really want to focus on is the fact that we have had situations now, unlike any time in our lifetimes before, where we have had to change the way that we practice. And so deploying remote workers does require a little bit more effort on the security side, because when things are going on within your practice, you have the ability to control that. When you are sending people home to work, you lose a little bit of that control. So I do want to talk about that from a HIPAA standpoint. So as I mentioned before, HIPAA rules continue to be enforceable for remote work, just like they always have been, and even during the COVID-19 pandemic. And so what you must do from a covered entity standpoint is make sure, again, that you've included the use of remote workers in your security risk analysis. And in addition to that, when you do a security risk analysis, the whole point of that is to figure out where your risks are and then mitigate those risks. And a part of that mitigation is making sure that you have written policies and procedures that let your staff understand this is how I need to do things. This is what I need to do to protect this information. So you have to have those written policies and procedures that address administrative, technical, and physical components of the security rule. In addition to that, you want to make sure you're providing ongoing security awareness training, just like you would in the practice. So we're going to talk about some different things that you can do in your practice to help you manage this. So the first thing you need to do is determine, are you going to own the equipment you're providing to your remote workers, or are you going to allow them to use their own devices? And we're going to talk a little bit more about the whole bring your own device or BYOD in a few slides. But I want to go ahead and put this in your mind right now, because this is an aspect of control that, in my personal opinion, if it were my practice and I was the one in charge of doing this, I would recommend owning the equipment and being in control of it, because then you have the ability to do what you need to do on that device. That's not always going to be a feasible option for you. When we started sending people home back when all of this happened, did you have time to go and purchase all these portable devices? Did you have the ability to issue laptops? Some of you may have, and that is fantastic. Some of you may have already had a plan in place for that. But for many, you were probably in a situation where you were like, just log on from home. And that worked. But what we need to do is we have to determine, is that the safest strategy? And if it's not, how can we make it safe? Because the protected health information that an employee is accessing from their home has to be just as secure as the protected health information that is being accessed from an office setting. So, which brings me to my next topic. You want to install appropriate security technologies. And when you do that, that means that has to be on company-owned devices or on personally owned devices. So that's where you see that a little bit of a rub between, I'm going to ask my employee who owns this device to allow me to have access to it so that I can include all of these security measures, or I'm going to make them put this extra security on their device, as opposed to me just giving them a device that has it on there already. So those are things you have to think through. But the bottom line is, same security needs to be there, because it's the same protected health information that you as a covered entity have an obligation to protect. So the other thing is making sure all of the latest software patches and security configurations are up to date. And this is a constantly evolving area. I am not a technology expert. I cannot tell you the latest patch that needs to be added to a device, but there are individuals out there that make a living doing this. So I would recommend that you have many conversations with whoever helps you with your information technology in your practice to find out what you need to be doing, how this needs to be happening. Because again, you've got a remote worker, if they're not docked at the office and hooked to your system, they may not be getting those automatic updates. Somebody needs to be making sure that those are done, because if we have a security patch issue and there is a vulnerability at home, that can impact your entire practice, just like it could if they were at the office. So we've got to make sure that you're thinking about these things. And then just to take kind of a step back from all the technology aspect, but really think about who needs access to what. How much information does a remote worker need access to? Because just like you are required from a HIPAA standpoint to determine minimum necessary, for your staff, who needs access to the entire clinical side of the record, or who just needs access to billing information? You still need to be thinking about these things when you're using remote workers, because when you're in a remote environment, you're outside of that protective bubble of the practice. So you really only need access to what you need to do your job, because then that lessens the risk of unauthorized access to other information. And password protecting devices, so important. And I still see this as being an issue because everyone hates the 12 character alphanumeric special character password, but we have to have those. We have to have those things in place so that we can have that added layer of protection. And encryption, even though it is not a required security standard, it is an addressable standard. However, if you can't encrypt a device, you've got to come up with a method that is just as secure. And so encryption is just easy, because if that mobile device is lost or stolen and it's password protected, and when it's password protected, it's encrypted, you are secure no matter what information is on that device. So I highly recommend that that be a part of your risk management strategy for your remote workers. And then utilize a VPN for access to your practice systems. Many of you may already do this, but it is just another safety measure that you can take to access that information. If you have the ability to implement multi-factor authentication, I think many of you are already familiar with that because of banking applications and other applications. You may already have this in your practice, but that is, again, an additional level of security. And when we have people that are remote, we have to have that extra level of security, even if they're not remote, even in the office setting. Many of these things that I'm talking about with you today can be applicable to your in-office people as well, just as that added measure of security. And if multi-factor authentication is not reasonable for your practice, and it may not be, then definitely incorporate those stronger passwords, which is that 12 to 16 digit password that has an alphanumeric and maybe some special characters included. And I know your staff, especially your physicians, are going to love hearing that, but it does protect your data. So Wi-Fi. Wi-Fi is everywhere now. I just got back from a short trip that I needed to take, and I needed to work while I was in the hotel. And I had I had a hotspot that I could use versus public Wi-Fi. I feel more comfortable with my hotspot than I do public Wi-Fi now, because it's just, there are so many risks associated with that. If you are allowing your employees to work remotely, I would recommend that they never use public Wi-Fi. There are just too many risks. In addition to that, if they are working from home, they really need to look at their wireless router password. Most of those are standard out of the box, and they can be figured out by people that shouldn't need them. So I recommend that you have them change their wireless router password to something that's stronger, so that that can just, again, another layer of protection. And that can be done by either a sentence or a phrase, but we want to avoid important dates. We want to avoid our children's birth dates. We want to avoid our children's names or initials. Those are always go-tos because those are easy to remember, but those are easy to figure out because of social media. So you want to make sure that we are not using those easy things for cyber criminals to try to figure out. And then when they are in a working at home environment, they need to make sure that they're working in an area where people that are unauthorized to have access don't. And this is difficult because you may have people working at their kitchen table or in their living room, but you need to have these conversations and you need to have policies regarding it, because even if a child of an employee, a spouse of an employee, anyone who has unauthorized access to patient information, that can be considered a breach, a reportable breach. And I know it may seem silly, but these are things we have to think about. And that information, you probably wouldn't allow just anyone and everyone to come into the office setting and hang out while information is being either accessed on the computer or laying out on a desk. Same concept applies for workers that are at home. So you have to have these conversations, and you have to work out some kind of way to have a private workplace for your workers. And I know it may be a little bit difficult, but these are accommodations that really need to be made. So also install remote wipe or disabling applications on all of these portable devices. So if a laptop is lost or stolen, if a tablet is lost or stolen, we want to make sure that we have the ability to remove any information that's on it. And I know what many of you are thinking right now. If we're accessing through our VPN and we're just accessing our billing software or our EHR, there's nothing on the laptop, there's nothing on the tablet. And that is a reasonable assumption, but I don't know if it's a logical assumption. And I'll tell you why. When people are working on their own, there are many times that they may run into a situation where they need to create a workaround. And so they may need to save, they may need to do a screenshot. They may need to download information and put it in an Excel spreadsheet. You have to address this, because especially if you're not going to have passwords and encryption, which I discourage you against, but you need to understand what's on that device. So you can't assume that people are just following the rules. You have to make sure that you have a written policy on it. And then I would recommend that you also periodically check to see if there is any data stored on that device. Again, that's why it's important to have this remote wipe, remote disable, because in the event there is something, if an employee reports a lost or stolen device, then if you have this application on those devices, then your IT should be able to remotely get that information off, and again, reduce your risk of potential breach notification. Because if a breach happens because of a remote worker and it doesn't have to do with telehealth, that does not fall under enforcement discretion. And then all of the things that we've talked about so far, you're going to be creating new policies and procedures. Those are going to be worthless unless you train your staff. So you're going to have training. You're going to have ongoing training. You're going to need to be talking about this on a regular basis to make sure that they understand. You're also going to want to get their commitment. They need to be signing confidentiality agreements, data use agreements, and some of this you may already have in place, but I think it's a good time to look at it again and make sure that everyone understands. If you have written policies and procedures in place that prohibit certain activity, but an employee decides that they're going to do something different, that is on them. And that is something that they can be held accountable for. So we want to make sure that responsibilities are known on both sides and that you have those in those written agreements. So I told you we were going to talk about BYOD, and I do think that this is something that's being utilized a lot because we did have to deploy a lot of people to home, and we may not have been prepared to issue devices to every employee. So it is important that you have an acknowledgement and an agreement in place, and that it does specifically state what devices can be used, what software can be used, and if you're going to permit an individual to use their device, we have to have this written out so that they understand their responsibilities and they also understand the responsibilities of the organization, which is what brings me to my next topic. So acceptable use. You're going to need to explain to your staff what apps that they can use during work hours, because if you're allowing an individual to use their own device, it's going to be very hard for them not to want to go check their personal email, to check their Facebook, to Google something unrelated to work. And I know that stuff happens in the office too, but when you're in the office, you might have more security in place. When you are allowing an employee to use their own device, you may not know what level of security is in place. And if they want to click a video on Facebook that could download malware, that's a problem, because then that could impact your practice. So you're going to want to make sure that you have outlined acceptable use if they are going to use their own device. You also need to think about reimbursement. Who's going to pay for what? If you are requiring an employee to use their own device and to use their internet at home, who's paying for that? Are you going to reimburse them for part of their cell phone bill because they're going to be using their cell phone to communicate with patients? Are you going to be covering their internet cost because they might have to have a higher speed of internet to be able to have that connectivity? So these are things you need to consider, and you need to outline it, and you need to be clear about it on the front end so that you don't have issues going forward. Security, this is again an issue. You have to have specific safeguards in place to make sure that device is protected. So how are you going to do that? You've got to think through that process, work with your IT professionals to make sure that they understand what your remote users are working with if they're using their own device, so that you can have those conversations and make sure that the correct security is in place. And then finally, from this standpoint, you want to make sure that you have outlined the risks and your liability and disclaimers and their risk of liability as well. If an employee is using their own device and you are going to install remote wipe or remote disable, there is a highly likely probability that their personal data is going to be wiped as well. They need to understand that before agreeing. So it is very important that they also understand they are going to have a lessened, they're not going to have as much privacy, because if IT has the ability to access their device, IT may have the ability to see what's going on in their email and other things. Now, granted, you're going to have to work that out on your organization's end as to what level of privacy there is, but your staff needs to understand that that is a risk of them using their own device. So that is something that you need to think about when you are developing this policy. And then you're also going to want to make sure that if they're using their own device, that they are doing the appropriate backups as well, because they have data that may be important to your practice that you don't want to lose if that device is lost or stolen, if they haven't appropriately done their backups. So from a patient confidentiality standpoint, this is probably something that is already being done in your practice, because your employees already need to understand that they have to keep patient information confidential. But this should even be reiterated again for your remote workers. They need to understand that they should only have access to what they need access to. They shouldn't be accessing anymore just because they're remote. They also need to understand that they have a legal and ethical responsibility to protect patient information, whether they're at home or in the office. That stays the same. So that idea of, if I'm going to work at my kitchen table and I'm going to have people in and out, they have a responsibility to protect that information just like they would in the office. So we can't allow the environment to dictate the level of security and privacy. You have to do that. And a great way to do that is through written policies and written confidentiality agreements. And then it is also important for the employee to acknowledge that they are only going to use and disclose information as it relates to their job and in the performance of their duties. So again, these are things that you're probably already doing in some manner from a confidentiality standpoint, but I just want to point them back out so we can make sure that just because the environment changes, the idea doesn't change that confidentiality is any different. So some additional things to think about from a home office standpoint: hard copy, PHI. We have to protect that just like we do the electronic information that we have. In fact, at home, it's probably a lot easier for paper to be inappropriately disclosed, because we're not thinking about it in the same way that we would in the office. So we want to make sure that we are storing any hard copy PHI in a safe and secure location. Any trash that contains PHI has to be shredded just like it would at the office. This is no different, but again, in a home environment, we may think it's different. So you want to point these things out and make sure that you're also making sure that your employee has a HIPAA compliant shredder. So we want to make sure that is available to them as well. Making sure, again, that they are in areas where unauthorized individuals, and when I say unauthorized individuals, that's kids, spouses, friends, family. It doesn't seem like a big deal, but it could be a big deal, and you still have that obligation. So we want to make sure that we keep data outside of their viewing or their reach. And then again, back to that network password, we want to make sure that that's different. That's not what the default password is, so that we can add that extra layer of security. And then using devices. This is tough, because how many of us have handed our child our cell phone or a tablet or our work computer, for that matter, to allow them to do whatever they need to do? we really need to talk about this when it comes to protected health information, because it may seem innocent, but it can crash your entire system. So you need to be thinking about these things. And one final thought is about scams. I mean, we're nearing the holiday season, so that's always a time when scammers with phishing emails or any other type of situation where cyber criminals think that they can access information, it always increases. But also in public health emergencies, in any type of emergency crisis, scams go up. We have to be training our staff to understand how to recognize those and how to avoid them. And this is a great resource that I would highly recommend that you check out, the Cybersecurity and Infrastructure Security Agency website. Check this out. There are lots of good tips, and I again highly recommend that you have your staff check this out. So I have given you a list of things to do, which is never fun to get homework from a presentation, but I think it is important to just summarize what we've talked about today, because we've covered a lot, and I know you're getting so much out of Thrive 2020. And so I want you to be able to take one part of this presentation as a to-do list. So first thing, you need to conduct a security risk analysis and make sure that you're including telehealth and remote workers if this is something you're doing. Even if you don't know if you're going to continue it, do this, because it will help you in the long run. If you're using telehealth, make sure your telehealth vendor is HIPAA compliant, and make sure that they will sign a business associate agreement, because going forward, you're going to have that in place. And this one is probably the most important, and I probably should have put this as number one, but stop any bad habits that have been formed during enforcement discretion. If providers have been texting more, if your staff has been texting more, if we're communicating with patients in ways that have been non-conventional and that we didn't do before enforcement discretion, we have to figure out better ways, because enforcement discretion is going to go away. And there will be things that come up that the Office for Civil Rights will investigate. And if they see a pattern of systemic noncompliance, that is not going to be good for any practice that deals with that. And so I, again, recommend you look at this. If you recognize these bad habits, even though they might be okay right now during enforcement discretion, you're going to need to make sure that they end once enforcement discretion ends, and that means you're going to have to put something else in place. Also, another good point, just again, be aware and in control of the security on all the devices that are being used to access your patient information, to transmit patient information, to communicate with patients. Be aware and in control of that security. And that is going to require some time and effort and communication with IT professionals that can help you get there. And then you're going to have to create and update policies. And I know that's never a fun thing to hear, but you have to do it. You have to do that to protect your practice, and you have to do that to protect your patients and your employees as well. So once you get those created, I can't stress enough how much you need to train. You have got to continue and have ongoing training that is surrounding the use of protected health information in ways that may be different than we have used them before. So this is your to-do list and your homework. At this point, I am done with my information that I'm providing you on this program, but I am going to be available live to answer any questions that you have. So thank you for listening to my presentation today. I hope you have been enjoying the conference, and now I am going to stop sharing my screen and answer any questions that you guys may have. Have a great day. Bye-bye.